Hey guys, I'm here with Dr. Laleh from Orange County in LA. We are going to be talking for the next hour or so. Dr. Laleh, how are you?
I'm great. Thank you. How are
I'm good.
you?
It's quite late on here and a little bit earlier in the day for you. So I've been excited about this one. We were actually recommended you on a story. I put up
Oh,
a story saying who inspires you, and someone had put your name down. So we threw up that reply, and then you said, "Oh, I'll come on the podcast," and here you are.
yeah, it'll be fun. I think it'll be really great.
Yeah. So you've not done something like this before, have you?
No, nothing like a podcast type. I've done some speaking roles, but nothing like this. So I'm pretty excited.
Yeah, so I mean, we're quite chilled out. We just want to find out more about you as a person, more about your journey through dentistry, and everything that's going on, and any kind of wisdom that you might have to impart. So, I think the first question we have to ask is, how was your dental school journey? You know, from pre-dent to becoming a dentist. What was that sort of that journey like, and when did you know that you wanted to become a dentist? What was your motivation to pick this career?
Sure. I grew up in a small town in Kansas City, around Kansas City. It was just middle of America, and I knew I always wanted to do health, be in the healthcare profession. I didn't know what field I
Mm,
wanted to be in, but then I did a lot of volunteering when I was in high school, and I got accepted to Creighton University in Omaha, Nebraska, which also has a great dental
yeah,
school. And when I was there, I went the route of pre-dent because I just love the art, abilities of dentists, and I'm pretty artistic myself, and I loved how you could combine the arts and sciences together. And I knew that that was kind of my calling. And I also knew that with dentistry, you could really help out your community, and then also just do what you love. And at Creighton. And when I was 19 years old, so the summer after my freshman year,
yeah,
I was 18. The summer after, I took my DAT and I scored really well. So I was able to complete my undergraduate journey in under 3 years. And I applied to only USC. It was my dream school. I was, from a small town, so I wanted, Southern California, and I'm a diehard sports fan, so I loved USC football, and so I applied, and I wasn't planning on even. I had a really nice DAT score, and and Creighton told me I didn't need to graduate to get into their dental school. So
right.
I got it, I got an interview, and they told me, oh, you forgot to put the year you're graduating. And I said, well, I'm not planning on graduating. But it was a really good decision to actually graduate from undergrad because you never know. I had classmates that couldn't, for some reason, some tragic event happened in their life and they couldn't continue their dental school journey, but at least they had their bachelor's.
Yeah,
So I'm really
yeah.
glad I crunched in 2.5 years. And when I was 19 years old, I got accepted into dental school. I was the youngest person in the school in my class. I think even up until graduating, I was like probably, I think, the second youngest student. I graduated dental school when I was 23 years old. USC was amazing for me because I had so much hands on help from the faculty and the upperclassmen, and I wasn't shy. I wanted to make sure I got everything. So I would ask all of my upperclassmen for help if I needed it. I
Yeah.
would go, you know, extended hours and talk to my faculty. And I really felt like it was the school for me. I really felt like I made a really good decision. And the campus is beautiful and it's always sunny. So that didn't hurt either.
Yeah, I can't I can't really emphasize on the always sunny bit, or understand what that feels like. We're always very lucky and very happy when it's sunny in the UK. But it's interesting that you say that actually you could have gone to Creighton and actually not had to graduate. But then, like you say, what if you got in and just hated teeth, but when you actually start doing it, what if that, it's just been, oh, this is the worst decision of my life, which I'm sure people do find out, they get onto the clinic and go, well, this is a waste of time. So yeah, it's I would say probably a good call as well to finish off that degree and have something, yeah, there, banked to fall back on.
Yeah. I also think that at that time, everyone, when they're going through that process, they're so rushed to get through school and just enjoy it. For me, I was glad I spent that time to get my bachelor's and I, got to take more classes. And that, I mean, it never hurts you. It always ends up helping you for your boards. You get a little bit, few more science classes under your belt. So, yeah, it's definitely a great thing. I would recommend it for every single person to get their
Yeah.
bachelor's.
Well, what is the benefit of not graduating? Is it saving a year's time or fees, or how? What is the actual point in, if you would say, actually, on the other hand, what would the benefit of not graduating be?
I think the few benefits are that you save a year of or 2 years if you can get it done, and if you can get your DAT by your sophomore year of undergrad, which could in turn, if you're not on scholarships and things like that, you could save
Yeah.
money. But aside from that, there the perks of having your bachelor's is always really good. So.
Yeah, it's just interesting because the American system is very confusing to people who aren't from America. So it's
Yeah.
nice to hear what all the different options are, because that's one that I've not actually heard before. And I've been doing these podcasts a good 6 months, and we spoke a lot about getting into dental school in the States and lots of different places. But it's the first time I heard that you could actually do it without finishing the undergrad. So
Yeah.
I've learned something new today, which is great. Like what was the big thing though? Like when you've gone to USC and
Mhm.
on an open day or whatever, what was it that just really grabbed the attention? You're just like, oh, this is the definite perfect place. Because you say you only, applied to USC, you didn't apply to any other dental schools. What was that like? That's it, that moment.
Um, I think USC, it's like the moment you step on campus. So, personally, I love the campus. I think that just the environment, the student body, the dental school is in the heart of the main camp. The medical school is kind of off, I think like 10 minutes away. So the dental school being in the heart of the campus, right across from the George Lucas Center. And so you see, people from all walks of life. And then you go into the school and the faculty are just so ready to teach you. And I remember, I was really big on pathology and oral medicine.
Yeah.
So I go every day classes to talk to see Dr. Parrish, which I'm sure he's still there. He's like world renowned, and he would let me just look in on all of the pathologies, the oral diseases, and it was just the feeling that the faculty knew that they wanted your success, which is, essentially what is the most important thing, for me is I just knew I was like, I can always go to any of my faculty members, even when I was in clinicals. If I was struggling with something, if I wanted, more
Yeah.
information, they were always available. As well as the student body, the upperclassmen, they were great. I mean, they were amazing, and there was a healthy competition within the students, but it wasn't anything unhealthy. At the end of the day,
Didn't become toxic.
yeah, at the end of the day, everyone wanted the other person sitting next to them to succeed. So it was just a really overall, the environment from the beginning to the end was just amazing.
Yeah, I think you got lucky there, because I think uh, a lot of classes maybe do have that edge where there are people who just want to be, wanting up each other and not kind of helping each other along and that kind of thing. So I think that you've stumbled on a really, really good class there. And it's nice to hear that the faculty were very supportive, which is obviously really, really important, because sometimes you maybe get in other schools, not that this was my experience, but I've heard that other schools, maybe the faculty were there because they had research projects or they had other things that they wanted to do, and this was kind of like, oh, you also have to do some teaching.
Yeah.
But it sounds like they were happy to really push you along and help out in whatever way was needed and necessary for each individual student, and like the guy who was helping you, showing you pathology, just nurturing that interest. So that's really, really good.
Yeah. Yeah, it was just a really good environment. And, USC, I take a lot of pride in USC, and I felt like every single student, it was their first choice.
Mm.
It wasn't a school where, okay, well, I didn't get into my first choice, so I'll settle for, USC. I felt like every single classmate of mine was just so thrilled and excited. And at the end, when we were graduating, just to get that USC degree, I know in Southern California, holding that USC degree means a lot. It opens up a lot of doors for you as a new graduating dentist. It's just that camaraderie and that connection that you have with other SC students. It's just, and other SC dentists. It's just something that money can't buy that.
Yeah, and you probably get that with other dental schools as well. You'll always have that, like, oh yeah, you went to the same place I did, and
Yeah.
we have something in common. So yeah, that's nice to see, and it's always good to hear that people are helping the young grads along and stuff like that. Did you see yourself doing any specialty training, or did you always see yourself going into private practice or general practice straight away? Is that something you considered?
Um, in the beginning, I wanted to do oral surgery, just because I was really young anyway, and I thought to myself, why not? I can do, a specialty, and if oral surgery is a little bit longer than the other specialties, it's okay. But then I found a real love for, I tapped into my artistic side and looking at, faces, facial features, line angles, contours, colors, shades. I really found a love for cosmetic dentistry.
Yeah.
So then I thought to myself, I can just have a general practice where I do a lot of the cosmetic dentistry that I love, as well as actions and things like that, is that I feel that I'm competent in. So I would say that, I kind of dabbled in, which I definitely recommend for every student to dabble in. Go to the oral surgery centers in your school, go and see endo, perio, and see what you love. And if you love a little bit of all of it, then, you can have a general practice.
Yeah, because it's difficult because we all go through dental school, and sometimes we don't have that huge amount of clinical experience. So you kind of just trying to edge your way through and see, oh, actually, maybe I'll be good at that. Maybe I'll be good at something different. So it's one of those difficult decisions in the end, and some people find that it takes a bit longer to find your path. And like we were saying off air, everyone's path is going to be a bit different, and it's something that I think you said as well, you struggle giving that really personalized advice because you've got an idea of what you want your life to be like and how
Yeah.
your mind works and stuff like that. And it's very difficult to give that same, unless you know someone really well, you can't give
Yeah.
that same sort of level of intrinsic advice. And like you said, copying someone's life like to a T. Like I'm not going to
Yeah.
copy. Well, I'm not interested in cosmetics as much anyway, but I'm not going to copy, for example, Dr. Appa, even
Yeah.
though I would love to have a clinic in London, Dubai, and wherever else he's got one. New York, is it? And LA, just everywhere.
Yeah.
So yeah, that's kind of, it's kind of one of those. So yeah.
I think that everyone should really look for their purpose in life. And I think we kind of touched on that, is when you find your purpose and your drive and your calling, and then you realize your journey is a little different than the next person. Sure, we can give you all the advice in the world, but really you just have to stay laser focused and kind of do your own path.
Yeah, totally.
So
And So what was your first steps after dental school? You know, oh happy we've graduated and you've got your, did you have a hat when you graduated? Yeah, you had the hat.
Get a hat.
Throw it up in the, we didn't get a hat.
Yep.
I was quite upset actually. We didn't get hats. Um, we got some nice robes, but we didn't get a hat. But what was the first job that you kind of took, and where has it gone since then?
So it's interesting because my family lives in Kansas City, and I was pretty much the only one in Southern California. So after dental school, the plan was to kind of head back to KC and be there. But then I just thought to myself, the opportunities in Southern California are probably so much greater for me just to get more experience because realistically, what we have one patient for 4 hours in dental school, whereas in real life private practice, what ends up happening is you can have like 3, 4 patients simultaneously.
Yeah.
So once I graduated, I had a really unique opportunity with another female dentist who was a private practice owner. And she really took me under her wing and taught me the ins and outs of the speed and the clinicals as far as like running from one room to the other, but also the business side of dentistry, which we don't get in dental school. Let's just be
No.
honest. I don't know if they do in the UK, but in here, in the States, it's just like clinical, and then okay, everybody has to go learn how to actually be a business owner. So, she taught me the ins and outs of being a business owner, what accounts receivables means and things like that, and insurances. And so I just was like a sponge. And that's kind of like one of my mottos in life is just be a sponge. Anywhere you go, if someone knows a little bit more than you, don't get intimidated. Just soak up that knowledge. After working with her, I had an opportunity to purchase my first practice, which I did. And 2017, I had a really great opportunity to sell it to another dentist. So I sold that office, and it was actually, I think it was 2018. And then I had an opportunity in between the time of that practice and my practice now. I had an opportunity to work with a gentleman, which I did predominantly all pretty much cosmetic cases in our office. And now I have a spa, which we're no. For me, I always try to tap into things that are not seen necessarily across the field. So in California, I don't know if you are aware, but every other corner is a dental office. So for me, it's like, how can I be unique so that patients thrive? They love coming to see me. So we are doing a dental spa. And so within the spa, there's going to be myself and an esthetician who's going to be doing the Botox, the fillers, and things like that while I focus on the dental side. So I'm really excited about that.
Yeah, because I think we have the similar thing.
I think we have the similar thing.
When you go in, it
Yeah.
feels like a hospitally, clinicky sort of that kind of feel, doesn't it? Sometimes.
Yeah.
If you're doing high ticket items, if it's a set of veneers, they're paying a lot and they're expecting a certain level of service, and to enable someone to want to fork out that kind of cash, you need to make them feel like in a buying sort of proposition mood. And if you're there in a very clinical environment, although yes, it is a clinic, it is a dental office or whatever, maybe having it like that, and maybe having something which is a bit more comfortable, nice aromas and stuff like that, is going to put someone at ease, in a better frame of mind. So yeah, and obviously you want your office to reflect who you are as a person.
Absolutely. Yeah. And, with the patients, like you said, you really have to give every single patient your all. In my opinion, if they're purchasing a $1 item versus a veneer, set of veneers, once you do that and you create that referral system, which I think a lot of dentists kind of, they they kind of struggle with that because they get this tunnel vision. Let me treat this one patient, whatever their experience may be. Let me just get, that one patient to say yes, and then I'll deal with it later, marketing and things like that. But I feel like if you are your true self and you're kind, and you kind of give your all to every single patient, you're going to have a
Yeah.
natural flow of
Yeah.
referrals. And so, yeah, I think it's great to be able to do that.
Yeah, it just makes sense to make it more like a spa. Do you know when you go for a massage, for example, you have that
Yeah.
relaxed feeling, you sit on a nice chair before you go in, and they're putting on some sort of calming
Yeah.
music, for example, or what, or they'll give you a cup of tea on the way in. I'm sounding very British there. But I don't know, is it what is it, a glass of water with a lime in it in LA? Is that what
Yeah.
you do?
They do tea here when to get massages.
You do.
Yeah, they give you
Okay.
tea.
But it's that kind of thing where it's that level of service above and beyond the very mechanical, I'm gonna cut your teeth up and stick some veneers on and it'll look okay. So yeah, I think you're totally right there. Um, what is it?
I think because, go
No,
ahead.
no, go for it. We're here to hear you speak.
Oh, I was going to say, I also think that it's because people are very anxious too,
Hmm.
and when they go to the dental office, we probably have the most high anxiety environment of any business. So yeah, giving them that little extra bit, that goes a long way. For us, we're just like, oh, it's teeth, it's second nature, But for them, it could calm their anxiety. It could like reassure them that everything's going to be fine. So yeah, I think that little bit goes a long way.
Hmm. And you spoke a little bit about having the mentor, the lady who spoke to you, took you under her wing. Um, do you think that was important for you as a female dentist, going out into the wide world and seeing that actually, you can be your own business owner, where I don't know what it's like in America at the moment, but there've obviously been times of discrimination against all sorts of different people, and did that give you confidence? Is that something that you thought about, or did she open a door that you didn't know existed? Or do you know what I'm trying to get at? Is that something that you
Yeah,
weren't really sure about until you kind of saw her work?
absolutely. Because dentistry is so male dominant. Whether we like to, I mean, it's getting better, I think, as time is going on, but it's still very male dominant. So I purposely handpicked a female business owner because I wanted to see her struggles. I wanted to see what she overcame. I wanted to see, and for me at the time, I was 23 years old. I not only looked young, but gosh, I felt like, who's going to take me seriously? I was like, I'm just a brand new dentist.
Mm,
But she gave me a sense of confidence. She gave me that feeling that you can do it. You can be a badass, woman, and have it all, and be a boss, and play, like these around you that are business owners. You can be a part of that group. And so it was really, for me, I always advise anyone who asks me, pick a mentor for yourself, and allow them to guide you for some time, whether it's 6 months, a year, to really learn from them.
yeah, I
So
think it's
yeah, it was,
important.
yeah. Yeah, if I was to blindly go and open an office when I first got, which I know people who do that. They get out of school and they're like, oh, I'm ready to go open up a dental office. And it's like, oh, wow, there's so much involved with that. So,
I mean,
yeah.
it could be possible if you've done, in the States, obviously, most of you doing an undergrad, if you've done a business major, or you've had some sort of,
Yeah.
backing in, or previous experience in business, and that kind of thing. Maybe that's something that pre-dents should look at, because dental schools aren't teaching that kind of thing. Certainly not in the
Yeah.
UK. And obviously we do dentistry as an undergrad anyway, so we do it straight at 18 years old. So it's a different situation for us altogether. But maybe for the American guys, some people in Canada who have to do this undergrad, maybe think about that. Maybe that would be something that could, take your game onto
Yeah.
another level once you leave dental school, because you have that understanding of teeth, but you've also, back in the day, you've a little bit of understanding about how to run a business and all these kinds of things that really matter.
Yeah, like having a business major or even a minor or taking at least some classes. I mean, that will help you so much. I definitely think that, yeah, they could definitely use from that being pre-dent. Look into that and look at that. That shows you that I'm not only focusing on the sciences, but I need to realistically think, can I be a business owner? Some people cannot. Some people are amazing at, dentistry, but then they realize they're not business owners and they're great associates. That's what that, in the States, they just work with another,
Yeah.
business owner, and they do just as great. They do an amazing job and they have an amazing lifestyle.
Yeah, it's we have the similar sort of thing, owners and then associate contracts, and then very few people are
Yeah.
actually employed, on a contract or anything like that. Um, it's usually like a percentage of whatever comes in, you get the percent of the profit. So yeah, it's interesting because it's again, like we said before, different people have different paths in life. If you're someone who wants to go and do a lot of traveling, owning a clinic, maybe it could work for you
Yeah.
if you've got if you've got it set up and it's just a perfectly oiled machine and it's going fine, and maybe you're doing less and less clinical and you can go off and do things. But maybe if you're someone whose clinic needs more hands-on, time in the office, then you can't go on 2 month long holidays or whatever it is that you
Yeah,
want to do.
exactly.
That's my dream there. You've heard my dream just now.
Yeah.
um
I just for 8 months and then work 4 months. No, I'm kidding. But
give me a few years. I'll work a way to do it, don't worry.
yeah,
um
exactly.
what is it about the cosmetic work and the patients that come in? Do you find that there's certain treatment that you just love doing? I know you've got the artistic eye and you like how things are looking, and to make things look pretty and all that kind of thing, and all that sort of thing. But is there something as well about the transformation between someone who's coming in not so confident and then afterwards that you really enjoy as well?
Yeah, I think you really hit the nail on the head with the confidence. So when my patients come in the door, I treat them like they're my family members. And sometimes I have patients that, of course, like you said, the cosmetics, you have the eye for, certain things as far as line angles and things like that. But when a patient smiles at you for the first time in their life and they walk in holding their mouth and and at the end of their treatment, they're smiling, that is the sense of satisfaction and gratification that you get that no dollar amount can give you that feeling of, wow, I made a change. I made a difference in someone's
Yeah.
life. And I feel like, yeah, I mean, dentistry, it allows you to have a nice lifestyle, of course, the obvious things, but really for me, it's like, that's my purpose in life, is every patient leaves my door, my office, with a sense of, wow, I have my smile back, or wow, Dr. Marafi really cared about me and she really took care of me, and she, like I'm no longer fearful, or I'm less anxious. And I think that being able to help people really was a game changer in me deciding my
Yeah,
career.
and there are different ways of helping people as well. There's the helping people who are in pain. There's helping people who've
Yeah.
come with a big throbbing abscess, and that's one thing that can be done as to get people out of physical pain. There's also the emotional, maybe I don't like what I'm looking at sort of thing as well. Do you struggle with that kind of patient though? Because at some point, we see lots of stereotypes in the media about maybe overdoing cosmetics and going from one surgery
Yeah.
to the next surgery to the next surgery. Is that something that's in the back of your mind? Because just thinking about it now, it just popped in my head that you're actually in the forefront of California, right in the heart of all the crazy Hollywood stuff. Do you see that coming into your office at times? And is there anything that you kind of look out for to go, actually, maybe we can do something different for certain patients, or how are you managing that kind of situation, really?
Yeah, I think that you really have to be able to put your head on your pillow and sleep at night, right? And you have to understand that there are times where you're going to have to say no to a patient, no matter what the dollar amount is, what the dollar sign is. You have to say, no, it is not to your best benefit to get this treatment. Instead, and be realistic with them. I have patients that sure, they come in and they want their teeth, fixed, and they think they're going to end up looking like Kim Kardashian when they walk out the door. If that's someone who's attractive to you, but and you have to be realistic and tell them that this is what your situation is right now, and this is what your situation is going to be in the end, and not just feed everything they want to hear, because in the end, patients really appreciate when you're honest,
Yeah,
and that
yeah.
goes, that honesty, that kind of stuff. I feel like being honest, being truthful, it will speak volumes, if to patients, and it will literally, that's one of the pillars of success in dentistry, because if you're not honest with your patients and you feed them things that aren't necessarily true, one patient's not going to mind, second patient, but then people are going to start to catch on.
Yeah.
So I think that's something that's really definitely yeah, you just have to be able to speak honestly with the patients.
Yeah, because you'll get that bad review, maybe, of saying, if you've been talking rubbish, and someone's found out because they've got a second opinion, uh, it comes
Sure.
back to bite you. So yeah, you always have to be as honest with the patients as possible, and all those kinds of things. Do you see much, or do you have many kind of thoughts on the whole body dysmorphia kind of debate as well? Because that's obviously something that's quite aligned with our work as cosmetic dentists, or aestheticians and stuff.
Yes. I've had, this is my 10th year in dentistry. So I've had throughout the years, I've had patients that you could give them the most elaborate, perfect veneers or whatever, and they will still not be necessarily satisfied. And then that that's not something, a lot of times as dentists, we take things personally and we say, oh, what did I do wrong? But at that time, you just have to step back and say, okay, this patient has more of an issue, with never being satisfied.
Mm,
And I think that goes hand in hand with the body dysmorphia. And at some point, you just got to kind of nip it in the bud and just kind of say, okay, I'm not going to do it anymore. So yeah, that's definitely, especially in Southern California, it's definitely true.
is that something you see commonly, that kind of person who you may be like, oh, actually, maybe I don't want to do this one because it's going to go on and the shade's not going to be right, and the shape of this lateral needs to be more curved, and all these, the little things that
Yeah.
become like an obsession.
Yeah.
Do you kind of, have you kind of got a sixth sense about it now when you see someone come in for the first time?
Yeah, I always tell associates that there's certain patients that you're going to end up having to marry that patient, because they're never going to be satisfied. They're going to want to come in all the time. But it takes time, but you should be able to, after a while, start understanding and recognizing those kind of patients. And it's also your verbiage. I think as dentists, we're very, sometimes when we first get out of school, very stiff. Like, you need this, this, and this. Okay, you don't want this, this. Okay, goodbye. You need to have that proper verbiage to really allow your patients to understand you and understand, the clinicals and why you are treatment planning the way you are.
Yeah, and that takes time,
Yeah.
to in the chair, showing them records, showing them this, showing them x-rays and stuff like that. So I think that's maybe something that you need to plan into your days. Actually, a new patient takes maybe an hour sometimes, maybe even longer, or they come back and go away and think about it and come back and say, okay, what have you decided? So yeah, I think you're right there.
Yeah.
I think, should we, have you how do you see yourself going in the future? Obviously, you've got the clinic now. Is it something where you think you just have the one, or maybe do you see yourself opening second location, third locations, or are you thinking maybe about, maybe doing some sort of further training to level up again and again? What's the future holding?
I definitely would love to take the clinic model that I have right now and multiply it into a second, third, and maybe fourth office in the area. And also, I mean, always just keeping up, continuing with my education and things like that, because dentistry is ever evolving. So definitely, I mean, I consider myself a go-getter. So I literally, I hustle, I don't just kind of, sometimes some people get complacent, and I'm always trying to, better myself. And I think having multiple offices is really my ultimate goal.
Yeah. Do you think that'll become a lot to handle at some point, where you'd be like, oh, I just want to retire and chill?
It could be, but training people. If I were to do everything myself, then it would be like a crash. Like everything would crash. But
Yeah.
if when you train proper people and put them in places and positions, then things start to move like a well-oiled machine.
Yeah, for sure. What's the best thing that patients ever said to you? Like maybe a compliment, or the best reaction to treatment after it's all been finished and done.
Best compliments patients give me is they like my teeth. They always say, "I want your teeth," and they always ask me. They're like, "Are your teeth? Do you have veneers?" And no, I don't. But I think that as far as compliments that the patients give me is, "Wow, that was painless," or "I thought that was going to be super, aggressive, and I was just going to be in so much pain." And like they come in the office like this, and then they leave just with relax, and you can see their shoulders are down, and they just have that posture that's super relaxed. And that's, I think, honestly the best thing, because your work speaks for itself when people see your patient smiles, or the fact that if you do like a root canal and they're not in pain anymore. But the fact that like the patient leaves there saying, "Wow, I could do that whole procedure again and I'd be fine."
Mm.
I would never want to put veneers on someone and have it be beautiful, but then have them say, "Oh my God, that was so painful the entire time I was wanting to leave." Because that's just the reality, is that people remember those things. So I think that's honestly the best compliment someone could give. They had a good experience in the office, and they, it was virtually painless, and, they were just very happy and satisfied.
Yeah, I do like how your nail varnish is perfectly matched to your teeth shade. I caught that one. How did you develop your mindset around, you're saying you're a go-getter, and, which is very American, by the way. So, but like, how did you develop that mindset? Is it something that was always there within you, or did it kind of come on in leaps and bounds as, you went through years of life and stuff?
I think that my mindset was, I developed this mindset very early in my life. My parents, they left Iran because of religious persecutions. And coming here, my parents virtually started their life with nothing. And they did it because so that their children, my brother and sister and I, could have a bright future and could, have the same opportunities. Whereas in Iran, we wouldn't have those same opportunities. So I saw that, and I saw the sacrifices that my father and mother had made for us. And for me, there was no options other than to strive and be successful in life, and wanted to pursue. And so when I was in grade school, I was always thinking of the next step, and then middle school, high school, college. And for me, I just never wanted to settle for something less than my full potential. And my full potential didn't always have to be, oh, I'm the best at something, but no, I'm the best for myself. I'm the
Yeah.
best than I was yesterday. I'm better than I was last year. So I always kind of push myself. And I think that mindset just kind of developed from very early on.
Yeah, it's important to not, I think it's good to have someone that you look up to,
Mhm.
but not to be, I don't know, jealous of, is that the word, or to like
Mhm.
measure yourself against in a bad way. I think some people thrive on that.
Yeah.
Maybe someone like myself, I don't know, let's just take bodybuilding or the fitness, for example. I might think, oh yeah, I don't know, so and so has got a really good physique. I'm going to work to that,
Yeah.
but I don't beat myself up because I'm not already that. I think that's a really important distinction. Some people can do that and some people can't. So um, always just maybe look at your own progression and say, oh, that's where I used to be and this is where I now am, and that's kind of, that'll make you feel better because you see the steps that you've taken forward. Or if you haven't taken steps forward, you can assess why, and then go from there. But if you're always fighting against someone who's doing their own thing and has no idea who you are, or that you're looking, then you're never going to win there, are you?
Exactly. Yep. It's perfect.
um we've asked you about your job now, I think, haven't we? So I want to know a bit more about like what makes you tick outside the office. What's like the balance, because you're doing so much work, setting up offices, you've upskilled yourself since dental school. How do you stay sane afterwards, and how are you keeping grounded? Or are you
Um,
high in the sky? You just, I don't, what's the ground? Don't need it.
I think for me, just having a well balanced life. So if I'm, in the office, I spend equal amount of time outside the office doing things that I love, like working out, for example. That keeps me sane. Meditation, spending time for myself and with myself, and growing spiritually. I think that that alongside with a healthy diet, healthy lifestyle of working out and things is just that for me. It helps me stay sane in the office as
Yeah.
well. I love dentistry, but equally, I take. If I have any kind of, if I'm having a bad day or any kind of, situation, I just put that and empty that into my workouts. So I think that it's really important to find hobbies and things that you love, spending time with loved ones and things like that. Just enjoying nature, enjoying your life, in order to have that longevity in your career, because you will burn out
Yeah.
if you don't, have a well balanced or have something outside of dentistry.
Yeah, I think that's what maybe a lot of people get wrong. You end up in this cycle of working really, really hard, and then working late hours as well, or starting early, finishing late, and then actually by the end of the week you're so tired you just want to sleep in all weekend, and
Yeah.
then before you know it, it's Monday again and you've not seen your friends, and where did all that time go? uh so yeah, you have to have that balance, like you say. um so what are the particular things that you do to, like, specifically, and I know we spoke before and we were talking about some gym stuff, and fitness and diet, nutrition, uh, and you've tried quite a few things. So why don't you list off your resume in and diet resume and stuff,
Uh,
and give us a little lowdown on each one.
now I have tried every. To me, it's like why I'll try it if it's available. I'll try it. I've tried spin class. I've had personal trainers. I've been to Orange Theory, which is like a fast hit fit workout. I've done CrossFit. You name it, I've done it, because to me it's like, why not tap into all those avenues to see, how far you can take your physical fitness. And honestly, it's helped me tremendously in dentistry because of ergonomics. We're constantly with our backs bent and, looking into like a little area of, in the mouth. And so fitness has really helped me, have, better longevity as far as like not having, back problems and things like that. And I just love it. I love the
Mm.
competition, um, in within fitness. Not so much like the physique of like, oh, she looks better than me or not, but more so I can beat her in that race, or I can pick up more weights, or so that's actually it's fun for
I'm
me.
scared
Yeah.
to ask what you're
And
lifting now because I'm only just back in the gym.
and my back squat when I was doing CrossFit, my max back squat, which I was really proud of, was 200 pounds. But for my body type, I'm only 110 pounds. So
What's
for me, I
pounds
was like,
I work in kilograms, so I'm just gonna Google 200 pounds and hopefully it's not much more. That's really good. 91 kilos. That's good.
yeah, yeah, it's pretty good for
I was
me.
I was worried for a second. You said 200. I was like, oh, 200 kilograms.
And we have to stop now. No. That alongside with a good diet. I predominantly, I'd say, I've tried being vegan, and I've tried, I think I'm 90% plant-based with, it's hard being, for me, it was hard being vegan and getting all my protein in. I felt like the amount that I worked out, I was always tired and a little like sluggish, because I wasn't getting that energy that I needed to, and maybe I just didn't have the vegan thing down right. But I try to stay pretty much plant-based paleo diet, where I try to eat a lot of not processed foods, just natural, healthy. I just try to stay healthy, I think.
Yeah, I think it's if it comes in a packet, maybe cut down on those things.
Yeah.
Super processed things. I was reading a study earlier where, I mean, it was kind of a moment, but the study was saying, the more processed food you have, the fatter you get. So, I mean, you can
Yeah.
it's kind of obvious, but someone's done the actual study on that now, so we know for sure.
Exactly.
Yeah, what was the orange? What was the orange fitness? What's it called? Orange something or other. I did Google it earlier, but I got very confused. It did look like some sort of high intensity thing where you're supposed to be like flat out for 20 minutes in an hour. Is that right?
Yeah, so they have this thing called splat points, and Orange Theory has ended up being the middle ground. I think my favorite kind of exercise, because of COVID, it's not open right now. But what they have is they have this thing called splat points, and if your heart rate goes up to a certain amount, a certain level, then studies have shown that what ends up happening is throughout the next 24 hours, your body's actually burning those same equivalent
Yeah.
calories that it did at that certain heart rate. And so what you do is they have a cardio component that's 20 minutes long, and they have the weights component that's 20 to 30 minutes long, and then they have like a cool down component. It's like people that want to just get in and out. Some people love to just live in the gym, and that's a different story. But some people just want to hit the gym or hit a workout after work or something, and it's just perfect. It's perfect. It's like a 55-minute perfect workout.
Yeah, I prefer. I don't like doing cardio in the gym. I really found it quite difficult. I think it's just very repetitive. Not that
Yeah,
lifting weights isn't, but there's like it's you versus the weights if you're doing the weights. But whereas
yeah,
running, it's very monotonous, I think is
it's,
the word.
yeah.
Yeah.
And it's just the same. It is. It gets boring, and you just kind of like, "Oh, again, are we doing this for another 20 minutes?" So yeah, I get it.
So yeah, I'm not very good at doing cardio. I'll be very honest. Much prefer, picking weights up, and I'm sure people who've been watching my reels have been getting very bored. But it's currently, during lockdown, I'm very used to, especially through uni, and I've only finished in 2017. I graduated, so I would go with my friends, and we would keep each other honest and make sure the other person was going, and kind of call you out if you were being a bit of a wuss and saying, "Oh, I'm too tired" or anything like that. When you're clearly not, because in your early 20s, no one's tired. So
Yeah,
it's one of those. I really miss that environment of having people to push you on. So now
yeah,
I've started putting the reel up of my workout every day. I'm trying to find the really cool angles. So like putting things on the top of the
yeah,
cage so they can see a different angle of a press and stuff
yeah,
like that. But it's actually made sure that I go in, because if I miss it, then I'm like, well, people are going to call me out and say you stop going now. So
yeah,
it's like
exactly.
keeps you going. I think consistency in whatever you're doing is more important than like doing something really crazy, like some super crash diet, like on the
Mhm.
diet side, and then rebounding all the weight straight back on.
Exactly. And especially with COVID, I think everybody had to get creative because I believe that the gyms just now, opened, and they're just limited hours and not everyone can go at the same time.
Mm.
I mean, the world we live in today is, it's just changing. So being creative, stepping outside, going for a walk, going for a jog, or doing things at home, anything to get your body moving, is really, I mean, I think that we're fairly young now. Later in life, we'll really thank our younger selves.
Yeah, I've got grey hair, so I don't know how young I actually am.
Yeah.
Um, but yeah, no, it's really important to keep your body active, especially, as dentists, we're going to be sitting down a lot.
Yeah.
So that means, your anterior chain is going to get really weak, which happened to me,
Hmm.
and it's very, very annoying, and it's very hard to reverse. So, pro tip, don't let your anterior chain get weak, because even if you don't have much fat, it'll look like you've got a belly. Uh, but the worst part is you then start getting back pain because you've got that imbalance in front and back. So that's really,
Yeah.
really important for all the dentists out there to keep on top of their fitness.
Absolutely.
Um,
I
yeah.
agree.
What other diets did you try? So you tried the veganism, which is, very, is it a cult or is it,
It's like, I mean, vegans all know each other. They all like, even on social media, they'll like spot you out. They'll say, "Oh, it's another vegan." I mean, it was hard. It's hard to get your adequate nutrients, like your proteins. I mean, I'm sure avid vegan, they know exactly where to get protein. But then I feel like a lot of that protein is processed, like tofu and things like that. So I couldn't. For me, it wasn't sustainable. But being more plant based, paleo, which paleo is just pretty much you eat everything that's natural, very limited processed foods. But for me, I just always, I'm not such a stickler on, I can't eat carbs, can't eat carbs. For me, it's just like eat foods that are
yeah,
natural, and not processed, and work out, and it'll all kind of just fall into place. For me, I actually like to put on a little bit more muscle, which I know a lot of females might not necessarily enjoy that, but I actually like to have a little bit more muscle. I think it helps me in dentistry, and I just like that kind of physique. And so, yeah, that I think my favorite diet is, that kind of that that paleo, that all natural foods and things
yeah,
like
just
that.
things that are coming in raw and then cooking them from, from scratch. Just pale,
I also do intermittent fasting.
do you? Right. Yeah,
Yeah.
that's supposed to be really, really, really good. Especially if you're someone who likes to kind of shotgun snack through the day.
Yeah.
Which I'm not too bad at, but I do have these like gluten-free cookies which are quite nice, which I like to have with my tea, which is what I had before before we
Yeah.
started. So yeah, I think I'm not too bad, but I probably can cut down on some like sugars and stuff like that. But I think it's like you say, it's that moderation, and I think especially with the vegan diet, you have to make sure you're getting like because at B12 everyone gets a deficiency in with something like that. Yeah. Did
Yeah, it's crazy.
when you were vegan? Because I find this quite amusing. Sorry. Did you
Uh-huh.
did you have to tell people as soon as you met them?
Yes, it was like, I felt like it was a cult. Like when, because if one and you didn't touch meat, or you were that person that told the waitress like, hold this, don't do that, don't put this butter, don't do that, it was like everyone started to stare at you. And it was like, so then I was just like, I have to just announce every time I go somewhere with people, hey, I'm vegan, the ones that don't know, because it's like, just judge me if you want, but I'm vegan. But it's very hard. I mean, my parents, I'm Persian, and
Oh, you can have a lot
Persian,
of kebabs, man.
Yeah, like meat and food. And I remember my dad was like, "What do you mean you're not gonna eat that? Like, what do you mean you're not gonna have kebab?" It's just, and so yeah, it was, yeah, but people do like on Instagram. I felt like a lot of people were like, "Okay, you're vegan. I'm gonna follow you. You're vegan," even though you don't have anything about veganism on your, like, it's just like a camaraderie. They're like,
I feel
"Okay."
like I should put vegan on my profile.
I think you'll get a lot of followers.
But I have so much steak, they're gonna get very confused.
Yeah.
No, the
Like,
cow
yeah,
didn't eat any meat. It's fine.
yeah,
I'll
exactly.
just stir the pot. Maybe I'm gonna put vegan on my profile and say, and then when I'm having spaghetti bolognese and I'm having, all these steaks and roast chicken and all that, be like, no, it's fine. I'm just a really bad vegan.
Yeah, you might. Yeah, exactly. It's just breaking my diet a little bit.
Yeah, no, it's one of those which it's intermittent fasting has almost come very similar. It's almost a little bit cult like. It's like there's a
Yeah.
whole thing, like there's a whole community behind it now, but it is very effective.
Hmm.
I think because that restriction. Then was it David Goggins? He does like 36 hours or something crazy. Like he can happily do 36 hours.
Yeah, it's crazy. I got the idea. I try to read a lot. So through the Bulletproof, the owner of the Bulletproof Coffee, the founder of Bulletproof. I don't know if you guys have that.
Let me Google him.
Yeah. He wrote a book that he talked about intermittent fasting, and just, I mean, I was like, I gotta try this. I mean, what's gonna, if anything, I just won't have like a lunch during my work hours, and I'll just be able to see one more patient. um, and so, and I always found that when I ate, early on, I was always sluggish throughout the day. So it really works for me, but I don't know if it's for everyone, but it works for me.
Yeah, there's definitely something to be said about it because I remember, and I wasn't quite intermittent fasting. It wasn't really that, but I remember when I was revising for finals, if I had something which was too carby in the morning, that day was finished and I didn't learn anything. So I ended up in this weird sort of diet where I would have coffee, or a mocha. I used to have a mocha, and I would have bananas, and I would have a couple of times that I would have that 7 a.m., maybe 11, and then 3 p.m. And then then I would have some sort of meal afterwards, and a big meal towards the end of the day. And I felt like I took more in because I was a little bit more alert. I don't know if the coffee just got me on edge and a bit frantic, and I
Yeah.
could look at the paper and actually take it in a bit more. But as soon as I had, I don't know, a packet of crisps, or I had some bread or something, that I was just, ooh, I feel like sleeping. And
Yeah, exactly.
yeah,
Yep, I agree.
so yeah, I
Yeah.
definitely agree in the intermittent fasting. I couldn't do it right now because I'm just at the house, which would absolutely kill me. And I'm bulking. I'm bulking, so I do need a few more calories in my belly at the moment. Um,
Nice.
it's Dave Asprey is the guy, Bulletproof
Yes.
Coffee, and he looks like Michael Scott, so it's it's making it difficult for me to take him seriously from The Office.
Yeah. Oh my
I'm
gosh.
gonna shoot you this picture across so you can see and see if you know what I'm
Oh,
saying. Um, hold on. Here it comes. You've got to see what I'm saying there. This is the first picture that came up when I saw him, and it made me laugh. I'm gonna throw it up on the screen for you guys and who are watching at home as well because that's made me laugh.
yeah. Maybe not go off of what his face looks
I know
like.
it's because my brother's been watching The Office, and
Yeah.
anything that he says is so ridiculous. Um, Also, if you've not watched The Office, guys, make sure you watch that. So there he is, top left. And yeah, we'll get rid of that. Guys, if you're watching, does that look like Michael? Yeah, we've got a little bit off topic there. I love it. Um, yeah, and then obviously you're in the gym a lot. What what is it that gives you? The gym gives you as a feeling that you just have to keep on going after that little jump. Like I don't know. Every time I come out of the gym, I don't know if you have the same thing. I feel like I've accomplished something, or I feel like I've made something happen. Even if the rest of the day I've just been not lazing around, but I've just been doing, standard work or even dentistry. I don't get that same feeling of elation after coming out of the gym.
Yeah, exactly. It's like that energy, even if you're super tired, and you go into the gym and you do even like a 45-minute workout, and you just, it is, you feel that sense of satisfaction of like, wow, I accomplished something. I'm a badass. Like I have energy now, and I can go and move mountains. Like that's how I always feel. I always get out of there and I'm like, wow, I feel like I'm Arnold or something at 110
Well, you did
pounds.
say
But
that you were trying to put on a few extra muscles here and there.
yeah. And then it's like seeing other people enjoy doing what you're doing as well, or, just other people trying to get to a certain goal. And it just kind of gives you that like sense of like, wow, we're all doing it together. And, even if you don't want to be there that day, just kind of, you go in and you just get it done. And then it becomes a lifestyle. It becomes a routine. It becomes just like brushing your teeth. Literally, for me, that's what it is. It's like I would never walk out of the house without brushing my teeth, so I would never, not work out.
Yeah.
So
Yeah.
yeah.
Is it a daily thing for you, or do you have like a weekly routine of different things that you do, or do you do the same thing every day?
I have, I try to do different body parts, mixed in with cardio. But I try to do like 3 days on, 3 days I work out, one day I give myself rest, and then 3 days again. So pretty much like work out 6 days a week. Just as long as I'm doing something, being active, something where my heart rate's going, whether I'm doing like my biceps or triceps or, back, shoulders. I try to hit every muscle
Yeah.
group that I can get them all worked out.
Yeah, I think like we said before, as dentists, it makes a huge difference having that, strength, those horrible third molars or whatever it is going to come out much easier once you can just put a bit more force down there.
Exactly. Oh my gosh.
Um, what just being very, very like vague, it's a very vague question, but where do you think you are the happiest? Do you think it's, or what was the happiest time within your life, do you think?
I think the happiest time in my life was probably when I was in school, just because I was absorbing so much knowledge. I was learning so much, and I had like this drive. Not that I don't now, but I had like this drive to like get to the end goal. And then I had so many fond memories with classmates and just like the experiences of college and SC. But I think my happiest now is just when for example, like when I come home after a long day, worked out, and I just sit on the couch and I'm like, I'm content. I'm content with my life. Like
Mm,
of course, I'm always wanting to better myself and strive to do more. But in that moment, I'm content because I'm proud of the person that I've become. And as dentists, it's not easy. It's not easy getting to where we are at. Whichever school we went to, whatever we did in the end, we're all the same. As far as our clinicals and things like that. So just being proud of yourself, and just, I think that to me is where I'm the happiest, is that it's like all the noise around you is just kind of disappears, and you're just like, yeah, I'm me, I'm myself.
do you
So
think that's the same as if I would say, when have you felt the most content? We're
um,
getting into a
I,
wordy kind of nature here.
yeah, yeah, I think it's not the same. I think that being content and being happy are, they could be similar, but like, well, if you ask me where I'm the most content, I would say, if I'm in nature outside, that's like where I could just like look around and look at, everything that's around me and just say, wow, what a life,
Mm.
you know, and having good health. I think that to me is just, good health and nature is something that really I would be content with and be okay with.
Yeah, I think it's an interesting question because you kind of see actually maybe who was it I spoke to? Dr. Nidhi. She'd actually worked in a whole number of different places. She's doing a residency in Philly now, I think. I may have got that wrong, but she's becoming a pediatric dentist. But she'd worked in Dubai, she'd worked in Kenya, and she was like, "Oh, it was really different in Kenya because you were just at one with nature because there was so little, crazy, technology and cars and stuff like that. You're very much living down to the earth." So it's very interesting that you said actually contentment is maybe different to the happiness. It's just an
Yeah,
interesting question that popped up. So yeah,
yeah.
for me maybe it's when I've gone out on a maybe not a holiday, but I've gone somewhere for a shoot because I really like my
Oh,
photography and capturing things and having a different way of showing whatever it is. So yeah, it's an interesting question. I think I feel like I'm patting myself on the back there.
it's a good question.
um, what was the strangest thing that you've ever seen? Maybe coming to the clinic or just in general.
The strangest thing I've ever seen. Okay. um, when I was working, it, um, my patient came in, and here I am thinking that I was going to be treating their teeth, and he just takes off his shoes and takes off his socks and is like, "Hey, doc, can you look, at like he at the his heel?" And just like so pleasant sight. I was like, "Oh wow, I think
What
you have
what
the
was
wrong."
it?
Oh my gosh, it was just like it. I don't think he. I mean, it was just so much bacteria, and just like I think he was diabetic
Yeah.
too, some open wounds. So I just told him, I was like, I don't think you're at the right doctor. But then I was just like, and that was probably like my second. I was like, God, I hope this doesn't continue like this.
Yeah,
Or
you may be thinking, what have I got myself into?
yeah, it's just like shocked. He's like, so you can't help me? I'm like, no, I wish I could. So yeah, that's probably the strangest thing I've ever seen.
Yeah, I don't think I've got anything that can maybe rival that. I had someone that said they're going to bite me. That's probably the most exciting thing that's happened to me.
Oh yeah, yeah,
Um,
that happened. Yeah,
yeah, that's crazy. So probably diabetic foot. We'll put that down as a first on the
that.
podcast. Is there anything that people like misunderstand about you? So I don't know, maybe from because if when we put ourselves out there on social media,
Sure.
we maybe gave off a certain vibe. Is there something people maybe who don't know you misunderstand?
I think sometimes people might think, wow, like she might have the perfect life, or she doesn't struggle or no hardships. And I think that what people need to understand is everyone has their own level of hardships. They have their own struggles in life. I wasn't spoon fed anything, in my life. I worked for everything. And that's why I always tell everyone who asks me how I got to where I am or how I did it and had so much, perseverance. And I just say, if I can do it, anyone can do it.
Mm,
I grew up in a small town where getting to this level and going to SC and becoming, a dentist was something that was, not in my realm of possibility if you had asked anyone in the community. So I always tell people everyone can get to where they want to be in life. Yeah, social media is a great tool in in some respects, but in some respects, they're just pictures and videos, and nobody's going to show their really crappy days. So that's why I always take time, and when people ask me questions on my DMs, or when people ask me, or leave comments, I just try to build that relationship with them, and just so they know that everyone struggles. You know.
yeah, it's funny you mentioned that because I was just thinking like I obviously take a lot of photographs when I go on holiday. So if you were to look at my profile, you might think I'm always in Rome, or like
Yeah.
I'm nothing I put. I'm gonna put it out there just so you guys realize this and hopefully see it. Nothing I put up on Instagram is chronological or particularly true.
Yeah, exactly. Yeah. So
There are planes in photographs that weren't there. There are helicopters, hot air balloons,
yeah,
birds, people deleted, people added, all sorts of things. So don't believe what you see.
exactly. So everyone probably just thinks you go on holidays all the time.
Yeah, I went with one friend and we just went crazy. We were there for 4 days and I think it was Rome. That particular time I'm thinking about was Rome, and we walked for 12 hours a day. And all we did was, oh, we'll go here, we'll walk, and we'll sit down and have a little bite to eat, and we'll take loads of photographs on the way, and then we'll do another walk to somewhere and get a bite to eat and take a load of photographs on the way. And we did that 12 hours, we basically, for 4 days. It was so much fun because, I'd not seen the guy in a long time as, my close friend. So we got to like really just chat and stuff and see all the sights. And somewhere like Rome, you can walk for 12 hours a day and still see new things. So um, definitely worth going if you're out there.
Awesome.
Oh, we've got a question from Peter Marnie. Hey Pete, how are you doing? From Riverside in LA. What is the going rate for school tuition at USC?
Oh, wow. I think when I was in school, I think it was like 85,000 a year. I think it's close to 100,000 a year now. And
That's
that's not like room and board. That's just straight
because
tuition.
Zoom is really expensive, isn't it?
Yeah, I know that computer, I'll tell you what.
Yeah.
Yeah.
I did see one picture. I don't know if it was a USC student, but they're now installing iPads onto the chairs to control the speed of the handpiece and stuff like that. I'm just like, you don't need that. This is a student clinic.
That's crazy. Yeah, you just gotta let them do
Yeah,
it.
well, that's where the tuition's going. They're just thinking of things to spend it on.
Yeah, you just have to have a reason.
Yeah,
So, yeah, that's probably the downsides of going to a private dental
yeah.
school.
Peter says, "Oh snap!" Yeah, that's quite a lot. Um,
Yeah.
yeah, I think that's crazy. The amount that it costs in the States to go to dental school,
Oh, yeah.
because I paid 3,000 a year when I was an undergrad doing my
Yeah.
dentistry.
It's like it's astronomically different. I think NYU is over 100,000 a
Wow.
year. I think it's even more expensive. I think it's NYU's the most expensive, and then it's USC. But I just think it's kind of ridiculous. Like, yeah, it kind of deters people from going to dental school or professional schools because nobody wants to be in that much debt when they get out. You
Mm.
know.
You maybe sometimes
So
have to have a safety net with, family or something, or some sort of plan, because
yeah,
that's a crazy amount of money, especially if you think, oh, you've gone through dental school. Oh, actually, I want to do oral surgery or ortho or
yeah,
endo, and now you're back in again for another 3 years.
yeah. And some residencies they pay you, but like at SC, the ortho program and stuff, you have to pay them.
Mm.
So it's like another 100K. So I mean, some people get out of $1 million in debt.
It's it's pretty scary.
Yeah, as dentists, I'll tell you, like, it's going to be hard to make that much and pay that back, you know.
Maybe that's the
So
point. I don't know.
yeah, yeah, you're just never going to make it back. Give
I'm
it
being very
back. So,
skeptical there, a bit of conspiracy theory. I don't know.
yeah,
Um,
exactly.
so yeah, what? This is another weird question, but I think it's a good one because I've not obviously spoken to you before, and I wasn't kind of you weren't on my radar until you got suggested less than a week ago. So what is there that I should ask about you that I didn't know enough to ask?
Oh man. Um, what should you ask about me? Huh? Wow.
This is one of those
Um,
to kind of like to stump you a little bit.
yeah. Um, I think that a big part of my life is, my spirituality. And not like that you didn't ask me, but people kind of like always brush over that because it's like a subject where it's like, I don't know if I should ask or not. Like your spiritual growth and that internal growth. And so not necessarily that you should have asked, but I think that's a big part of who I am and why I strive to be a good person, and help people, and just kind of live my days, trying to be as honest as I can and just as forthright, and just try to be a decent human being. But my spirituality plays a big role in that.
Where do you think that comes from?
I think it comes from my parents. A lot of it comes from my parents, just because they're very spiritual people, and just have taught me to do the right things and be a good person. And when you do good, and you're a good person, then things come back to you tenfold, and good things happen in your life. That energy, I believe in that energy, that positive, attraction. What you want in life, you really are attracting throughout your day. And so that's kind of from like being very young and learning that into my adult life.
And I get it, you've kind of given me a question here, which might be quite deep, but what is it you maybe want from life?
I think that for me, it's just all about my spiritual growth. So for me, I want to grow. I know I don't too deep, but I feel like doing good in this life will really help you, help your energy, whatever you might believe in. If you believe in God, if you believe in some kind of an energy, force. When you do those things, when you are a good person, and you're, like I said, an honest person, and you give to your community service.
Yeah.
When someone doesn't have enough office to do free treatment or whatever it is, because I feel like that helps us grow, and it helps our spirits grow and our soul. Kind of you start attracting that into your life, and kind of as you get older and older, you're more focused on your internal as opposed to your external.
Yeah, I think you're right in that, if you are doing good within your, personal life, that it does somehow just come back at you in a good way.
Yeah.
And it's always nice to see that, if you've done, even for your own personal satisfaction, if you've done something good for someone, you see it just really help them, and you actually see that change within someone. So it's nice to see as well. So yeah, I think that's really important. I think, yes, maybe in the modern world, spirituality has been almost thrown to a side a little bit, because everyone's in the rat race, everyone's trying to, like we spoke about, one-upping each other. So maybe that's something that people need to think about. And I know there's a bit of a movement within the States. There's guys like the dental yogis who are, all about the spiritual lifestyle, and, thinking about what they do and how they do things. So maybe that's coming back into the fore in some way.
Yeah, I think that the energy you give to people, things, nature, that energy is 100% going to be reciprocated back to you. There's never been a time where I've done something positive and good for someone, or I don't necessarily see something positive and good come back to me the next day or the next week or month or year. But eventually I say, that's why I'm where I'm at, or I got help in this aspect of my life, because I've done, good for, out of the goodness of my heart. I try to do that with that I do. That's why it's like so hard for me to understand when people kind of like just focus on just the dollar amount, or just kind of, to me, it's like you got to have a deeper meaning to your life than that. Because once you attain that dollar, once you attain the financial freedom that you want, you'll still feel empty if you don't have another purpose, in my opinion.
Yeah, there's something that, I mean, I get quite wound up about. Sometimes I get quite wound up about politics in the UK, and there's something someone wrote on Twitter the other week. Oh, the Tories know. There's two parties in England. There's Labour, and then there's the Tories, who are like in power, and then Labour's the opposition. And not people are not very happy because of the way COVID's going. But someone said something that really stuck with me. It was like, oh, that they know the cost of everything, but not the value. And I think that's kind of what you're trying to get out there as well, because doing a pro bono case or helping someone out off your own time has value, but you may not see like a monetary return on that.
Yeah, I mean, there's studies that show when you make someone else happy, or someone else is satisfied, or smiling, you actually release the serotonin. Your body actually gets more of the positive effects than the actual person that you did the work for. And so I believe it. I'm a firm believer in that.
Yeah, there was someone I was speaking to. I think I watched a podcast, and someone was saying that I can't remember who it was or what podcast it was. I was watching, probably Joe Rogan, because that's the one I watch a lot of. But one of his guests was saying actually maybe the reason we have a lot of people who are maybe depressed is because everyone's looking at themselves.
Yes.
And not looking out for each other. You don't have that community sort of, I'm going to help, we're going to help each other out. I'm going to help so-and-so, I'm going to help so-and-so. But like you say, there are actually studies out of this that show that if you can, first of all, be grateful for what you have, there's actually a therapy for people who are depressed, is actually just get a piece of paper or a diary and write about something that is okay in your life or is good in your life. And you just, maybe once a day you write 2 things or something. By a month you've got 60 things that are going well in your life, and actually then you say, actually I've got all these blessings. And then the other thing they were saying was, helping other people makes you feel better, and it's a way to combat depression. And maybe again that's something we see that people aren't doing, which is why we have like a mental health epidemic or pandemic, whatever you want to call it.
Yeah, I agree, definitely.
We had an interesting one as well. Where's it gone? Yeah, so you obviously think spirituality is really, really important. Where do you think you would be without that kind of part of your life? What kind of roads do you think it would have led you down? Do you think it's really helped you get to where you are? I think obviously it has.
Absolutely. I think that just keeping that in my life and this, like that's my core. You were talking about how your core, when it weakens in dentistry, it's like you have problems ergonomically.
Yeah.
I feel that's to kind of figuratively put it like that, is just that's my core. I feel like that has kept me from doing wrongs in my life, and it's just really kept me grounded and kept me humble. I think that no matter where you are in life and how much success you have and how much money you have, whatever you have, being a humble person and your fruits of your life, giving it to other people so they can flourish as well. I think that that's something that to me is the whole purpose of life. In the end, no one's going to remember you for what you had. They're going to remember you for how you treated people.
Yeah.
I think without my spirituality, I wouldn't be who I am today. And of course everybody goes through struggles and hardships, and even through those hardships, I was able to look back on, I'm a Baha'i. That's my religious belief. And so as a Baha'i, that's kept me really centered and focused. And even through my biggest struggles in life, I always turned to that aspect of my life and just knew everything was going to be okay. So, I mean, I would not be at all. I don't even think I would be 50% the person I am today.
I think it's really important, kind of how your mental state is stable to be able to, let you do other things within life, successful careers and physique or, whatever else you're trying to accomplish. So, yeah, I think that's really, really important. What's the most interesting place you've been to?
I think the most interesting place I've ever been is probably Israel. And I'll tell you that is because there are so many walks of life. There are so many different people that have all gathered in one area whether it's for their certain religious beliefs or whatever it may be. And you just see how people just like cohabitate, they live, they just are around each other, and it's nothing like the news. It's nothing like, I went and we walked by the Mediterranean Sea, and I just saw so many different types of people, Israelis, Persians, Arabs, Africans, everyone. And I was just like so fascinated. And it's such a beautiful place that it has so much history. I think it just stood out for me.
Yeah, and is there any other places that you're maybe wanting to go to that you've not been to yet that you think will like are on your bucket list or anything like that? I know a lot of Americans like to tick off the major European cities, and that's kind of like a big thing. Is there anything that you've got like that?
I think I would like to go to one of my bucket list places to go is
Yeah.
Iceland. Yeah, just to maybe see the aurora lights and just kind of get that nature, that feeling. I've seen. I think it's just beautiful.
Yeah, I've it's been on one my list as well because you've got the hot springs there as well. But then you could also even go to maybe like Norway or somewhere like that where you've got some really cool cruises and stuff like that to do. So yeah, I think that's something that you're never going to see in any other way kind of in the world as well, isn't it? It's a unique experience if you get lucky when you're there and you see them.
Yeah, exactly.
Um, I think that's pretty much most of what I had to ask you, to be honest. Like, I think we've got to know a lot about what makes you tick and how you kind of view dentistry, especially. Is there any things that you would tell if you could tell yourself at 18 or any young person wanting to get into dentistry or undergrad, what would you tell that person? Something that you wish you'd known when you started, kind of like a parting gift to them all.
I think it's just enjoy it. Enjoy the process. Enjoy every bit of your journey to get, because once you get to that point, then it's like, like you feel, the weight is off your shoulders, and then you have this new journey. But just enjoy your journey. And one thing I will say is people are oftentimes afraid to ask. They're afraid to. That's why experts are there. I tell people that all the time, and I always, ask me if I don't know it, I'll ask somebody else or ask somebody else. But always try to get, if you don't know something and you're struggling, or you just want some advice, or you just want to talk to someone,
Yeah.
just reach out. There are people that will help you. There are people that will give you guidance. And you should enjoy every bit of the journey, because in the end you'll get there. If it takes you an additional year, 2 years, whatever, if you really want it bad enough, you will get there.
Yeah,
So
I think that's really good because people ask me a lot of questions a lot of the time because I've got quite as soon as you type dentist in it comes up now, which is great. And a lot of the time there are questions that come up I can help. Sometimes it's like we said, questions which are more personal to someone, and it's very difficult to give those kind of answers. But if it's if you've got specific something to ask, I'm definitely down to give advice as long as it's within kind of the things that I know. So I try not to talk about things I don't know about because that's dangerous, right?
yeah.
But no, that's really really good, and hopefully everyone will take that on board. But thank you for joining us. If you've been watching, make sure to subscribe. Make sure to head over to Dr. Laleh's profile. I'll be dropping the link underneath the video to click on her profile and go and follow her. Is there anything else that you've got to plug?
No, that's it. Thank you so much for having me. I really appreciate dental pages like yours on Instagram. I think they're very informative and inviting, and it kind of allows people to tap into our career and our lifestyles. I appreciate it much.
No worries. And guys, thank you for joining us. If you've been watching live. If you're watching the replay, then make sure to hit the like button, to leave a comment, any questions for myself or Dr. Laleh, and make sure to hit the notification bell. We've got loads and loads of live videos coming up. Tomorrow we're going live with Endo Genie, so we're going to be talking about technology and endo and a few other things that he's involved in, and plenty of other guests over the course of the next few weeks, and I'm sure for many weeks to come after that as well. And if you're enjoying the things that we've been doing, check out the link in the bio, which is to the Patreon group, which is where you can support the channel and Dentists of Insta. And there's a nice little community body there of dentists and other professionals. You get a few perks as well. So if you're interested in helping me out on that side of things, then check that out for us, guys. But thank you for joining us. Let's just end the stream. Cool. All right, it's done.